Hi, Dr. Rob Kiltz. How's everyone doing? I'm just starting our fertile fireside chat and got the fire on tonight. It's beginning to feel a little like fall, and we're just going to go nice and slow and easy. Lots of questions, lots of comments, and really welcome to all, East Coast to West Coast, 8 p.m. Sunday nights, fertile fireside chat. Quick one, next Sunday, I'm going to be at the ASRM meeting in Denver and likely not going to be on live, going to be learning a lot of new things, talking to a lot of people from around the globe about new ideas. And, always hello to Nicole, Angelica, Bonnie, and really that everyone's out there joining us and listening, and we're all learning together. Questions, comments, shares, likes. We really want to share the story of affordability, quality access, and remember we have full financing for everyone. We're really working to find the lower cost medications, protocols. We do a lot of natural and mini cycles, so whether you're doing IUI or IVF or trying naturally, our intention is to give you advice to help you conceive naturally first, and if it hasn't been working naturally, help you with assisted reproduction. And if you don't know already, I talk a lot about inflammation as the cause of all disease, including infertility, just another inflammatory diseases. And I talk a lot about keto. And Kiltz's keto is very narrow, bacon, eggs, butter, beef, but check out Maria Emmerich's stuff, and always sharing Maria Emmerich. She is awesome and amazing. Is a lot more variety than I talk about, but she hits a home run and will share some really great advice. We've seen so many conceive naturally with Emmerich keto or Kiltz's keto, and by reducing inflammation within your Ferrari. Remember, your body is the most valuable, expensive, and irreplaceable in the universe. And we in general have been taught to treat ourselves like a Yugo, a junk car, which is disposable. And you and I are not junks. We are valuable. We need to be thinking better of ourselves, better of the people around us, and putting into our mouths only the pristine, most amazing, and limited natural, organic, grass-fed foods you can imagine. Let's see, Kathy from East Syracuse, Britt. Remember, we are sharing prayers for everyone. This is a village. The village is how do we help more people everywhere on this very, very hard journey of infertility. We want to start with believing that we're all fertile and everything is possible, and don't give up. There are times when IVF becomes a diagnostic procedure, which we might find that even though everything looks normal, eggs and sperm and embryos look perfect, we don't get fertilization, or they fail to cleave, or they fail to blast. And we begin to learn something more in this journey about possibilities like a laparoscopy or hysteroscopy for endometriosis. Really, really important. We've been talking a lot more about doing that laparoscopy early on, or if everything else is failing, get it done by your OBGYN, your RE specialist. Talk more about it, because endometriosis is just another inflammatory process going on in the belly bucket. And the belly bucket, that's where the bowels are heating up. Gaseous alcohol, aldehydes are being fermented and created there, which is affecting the testicles, the prostate, the seminal vesicles, the ovaries, the uterus, and the tubes. And these ideas don't make much sense because it's not what we're taught. There was a really great book about by Richard David Feynman called The World Turned Upside Down, and that's when I learned so much of this. Also from Maria Emmerich, Gary Taubes, Andres Ianfeld, and so many others to learn how the food we put in our mouths that is labeled as healthy more likely is not. Too much carbs, fiber, bacteria and yeast that is just fermenting, and that glucose is glycating and it's so horrible. So, questions. Angie Thompson, how you doing? Can inflammation cause an increased risk for ectopic pregnancy? Now, ectopic pregnancies are where the embryo implants in the fallopian tube or any place outside the uterine cavity. The cervix, the beginning to the distal end of the fallopian tube, the fimbria, or even outside. It happens in about 4% of IVF. And the damage to the fallopian tubes, either a gross view where we can see with just our eyes or microscopic damage that we can't see, is because of inflammation. My bet is, again, inflammation that's taken in through the gut is spread throughout our bodies that causes all the damage and disease. It starts very, very microscopic: vasculitis, hypertension, thyroid disease. It's really so prevalent today. So many are getting diabetes, hypertension, migraines, irritable bowel, colitis, and it's a phenomenal story that I, as a physician, a reproductive endocrinologist, was not taught this. I learned it from my sister Marianne, who passed from diabetes at age 52, and that the standard diabetic diet is extremely high in carbohydrates, which is the standard American diet we're all told is healthy and good for us, but it is not. And I've seen so many that have just conceived naturally, AMH goes up, FSH goes down. Suddenly, when you thought, no way, even in your 40s, we can see the change and the turnaround. So my intention is to share something new and different that I didn't believe, but we're seeing diabetes, hypertension, colitis, Crohn's, arthritis, skin disorders go away. People's brain fog go away. They feel amazing. And I'm just like amazed at this concept. My job is to teach new information. I talk about inflammation, because inflammation causes diabetes, heart disease, cancer, stroke, infertility. There's an interesting article in the New York Times about psychiatric disorders getting better with antibiotic therapy. The recognition that most of these are simply an inflammatory disorder that's caused by plant antigens, phytochemicals, those lectins, the latex, the phytochemicals that cause brain fog and all the disorders, but mostly the fermentation in your belly from the bacteria and yeast and the probiotics is messing it up really bad for all of us. Let's see here. Kathy Vogel, can't wait to find out more about the Atlanta. We met with the Atlanta team this last week in Syracuse. It's coming. We're going to start doing monitoring consults and IUIs and sperm freezing. And by helping those in these satellite locations find an easy access to affordability, quality, and again, so many are conceiving with simple things like intralipids. We're working on PRP, intrauterine infusions. Take a look, just Google platelet-rich plasma. It's basically stem cells, and these stem cells are so important to helping in the vasculitis and the healing of our body. So I know it doesn't sound like it makes sense, but we call it idiopathic, unexplained. What I'm finding is that our unexplained is immunologic for every disease. It's really simple if we just simply step back. It's no wonder we're all getting sick and diseased from all of this. Hey, Amanda, Harmony, always a pleasure. Nina from Texas. Kimberly, how are you doing? My great travel global team is amazing. We're grateful to all of them. Rachel Barrage from Pennsylvania. Really, really grateful. Maya from actually, I can't remember where you're from. But again, we're really grateful for talk to a friend, share the stories. It's not a perfect process for everyone, but we're always wanting to learn more from your advice. We're working on getting those those phones to pick up faster. Use your portal and correspondence. And so many text me or email me that I can share it with the rest of the team to making sure that you're getting the very best. And if for some reason I'm not responding to an email or a text message, please throw it back at me. It's really critical and important. Let's see. Let's see. Atlanta's here already, just not open. October, and I know that's tomorrow. And technically, yes, we have a few more little glitches to take care of, but it is essentially here. Let's see here. Buffalo will be doing transfers anytime soon. I'm working on the IVF lab in Buffalo. Our new doctor, Dr. Ann Wold, is joining us starting tomorrow, so we're really excited. A great shout out and welcome to Ann. She's going to be taking care of our clients globally, working mostly out of Syracuse and working in our Rochester and then our Buffalo. We're working with the Multnicks in our Buffalo location. They're coming here to do retrievals and transfers. Much of what I like to focus on is, remember, the cause of infertility is inflammation. We want to take care of that as best we can. And so the best way is, number one is, remember, epinephrine and cortisol are stimulated in stress, fear, worry, regret, judgment. If I'm judging against that out there, it's hurting me in here. That's why any of the negative stuff we're all sharing within ourselves is hurting us, but it's emotional. And we have a great support team. Erin is working on the Fertile Hope Yoga, which is really about slow it down. And I don't know how much you've heard that I recommend walking slow and easy. If you're gonna go for a nice, light, easy bike ride, but none of this to stress the heart, which stresses the inflammatory reaction and response in the body, it is deadly for all of us. And I tell people, get off the treadmill. Even kickboxing, all that stuff that is really inflammatory, it shuts down the core, it sends blood flow to the periphery, and it robs the ovaries, the tubes, the uterus, the prostate, the seminal vesicles, the testicles of the blood flow they need. And I believe that hemorrhoids and varicocele, which is dilated vessels in the testes, is all caused by the intra-abdominal pressure from a high carbohydrate diet and the active exercise we're doing that just constricts the blood flow going back to the heart, which isn't good. And this is why yoga, meditation, prayer, and I've just thrown out a couple of really good books that I found really helpful. The Mastery of Love by Don Miguel Ruiz, The Four Agreements. Check out Eckhart Tolle in A New Earth and The Power of Now. And check out my website, Mind, Body, Smile. And over the last 10 years, I've been sharing meditation, poetry, which has helped me reduce my cortisol and epinephrine levels. You can tell I'm a high energy, and I need to slow it down also. I do pottery and painting and writing. I kind of hack at the guitar. I could use a little more lessons for sure. And my daughter once said, "Dad, you can't sing until I practiced." And she said, "Wow." So we're all practicing every day to get better at this journey because it is really, really, really challenging. So keep at it, by the way. Don't give up. All right. Lisa Anzua, hello. And will Atlanta be doing retrievals and transfers? February, March might be a little early. We're mapping out a better location, but we're looking at some other opportunities to bring it to the Atlanta area. But mostly is our best way is the hub and spoke to keep the prices really down, since the laboratory and the IVF part of it adds to the cost. And really the travel is easier than most of us understand. So diagnosed with a small bowel intestinal overgrowth, had 4 failed IVF cycles and a miscarriage after the third. This is from Tony Lynn Romolo Sturk. Okay, so remember, we're feeding the gut with nature's toilet paper, which is fruits and vegetables and fiber, the bacteria and yeast are all over it and piss and poop all over it. It's really difficult to clean it off enough because even triple washed lettuce is highly contaminated. We get a tremendous amount of overgrowth in our belly from eating a high, simple, complex carb diet. And basically, this is where a 30-day trial of antibiotics, and back to that article in the New York Times, which talked about minocycline, doxycycline, which seemed to help so many with so many of these diagnoses of psychiatric disorders, depression, anxiety, maybe even schizophrenia. They get better by a course of antibiotics. And my bet is it may be 30, 60, or 90 days. We know that with Lyme disease, a longer course of IV antibiotics to really get to the nooks and crannies. But remember, if you keep on feeding the body a tremendous amount of contaminated carbohydrates, fruits, vegetables, and fibers, which are uncooked, that's going to just continue to inoculate the bugs and the bacteria within our belly. And it's really the most amazing story I've ever learned. And I'm betting $1 billion on this one. And I know from so many that we've been sharing this story. But using a longer course of antibiotics, a Z-Pak Doxy, for both partners helps reduce the infections likely in the bowels, and then the nook and crannies of the uterus, the tubes, the ovaries, and the same thing goes with the male side of things. So let's see, Heather Schellmeyer, URMC, what different treatment options do you offer? Well, listen, the doctors at URMC and all these other places are really awesome, by the way. We've been integrating Eastern and Western medicine for many, many years. Meditation, yoga, acupuncture, massage, light therapy. The reducing the stress and strain, very critical. We've also been utilizing a lot of the immunologic treatments. As a reproductive immunologist, we do a lot of blanket approach immune treatments, Lovenox, aspirin, prednisone, Plaquenil, Prograf, intralipids, IVIG, Humira, LIT therapy. Just look up leukocyte immunotransfusion in Toronto at Markham Fertility. The treatments have been around for a long time, but the Western medical science isn't very keen on things that quite haven't been proven properly. But what you'll realize about many of the studies, they're very prejudicial and I think do not do well at looking at things that aren't in the mainstream and can't be packaged as a pharmaceutical that can be sold for a lot of money. So many of the things that we work to teach is how can you take control of the Ferrari every day, slow it down, and learn ways to calm the mind. And remember, bacon, eggs, butter, beef doesn't make sense, I know it. High fat suppresses inflammation. The studies are there. Carbohydrates and a high plant-based diet, I'm sorry, I think Gundry and many of these others are wrong. Variety, color, spices are deadly for us, just like having extra boyfriends and girlfriends on the side of our partners is not good for any of us. Let's see, can we use expired meds? Listen, I'm not gonna say yes you can. My bet is a lot of those dates on there have been forced on things, and so you're gonna use anything at your own risk, and so you have to make the decision on your own for that one, I'm sorry. Use of Neupogen and priming and stimming. Britt Thomas, good question. So GCSF, granulocyte colony stimulating factor or growth factor, Neupogen, is generally been used for implantation, improvement of the lining, either as an intrauterine wash or a sub-Q injection, microgram per kilogram, and we tend to use a maximum of 60 micrograms a day, starting typically preparation for transfer. But more and more we've learned from Dr. Braverman and others that even using in stim and priming may be helpful. And again, the data on these is not solid, but if what you're doing isn't working, I've always said, there's got to be a way that we're going to look and do something different, and the stories are out there. And the more and more we are all sharing stories, we will find amazing ideas from others. I've learned about low-dose naltrexone, cannabinoid oil, CBD oil, that's hemp oil. It's from the same plant as marijuana, THC, but it's a low THC product. The cannabinoids are essential oils, essentially, that reduce inflammation. So we've been talking a lot about that, but we've been using Neupogen both as an intrauterine and a sub-Q for improving the lining and implantation, but more and more looking at it and talking about it as a priming med or a stim med, along with either growth hormone, omnitrope G, HGH, human growth hormone, DHEA, low-dose naltrexone, and remember, Kiltz is keto, Emmerich keto. Those are the two ketos I'm really sponsoring and promoting. And I know, kid, I am very narrow, and Maria gives it a wider berth, but she's got some really excellent stuff. So remember, check out Maria, mindbodyhealth.com, and she's really got some really great stuff there. So I hope that helped answer the question about the Neupogen. We do really believe it's important. And Alexis Taylor, how do you feel about Lovenox for multiple losses with MTHFR and other clotting factors? So I do believe that the thrombophilias and the microvascular blood clotting that happens throughout our body, and it causes basically every disease we know, and it's happening younger and younger and younger, that Lovenox may help reducing the platelet aggregation in those small vessels, which is in basically think of the ovary and the testicle and the uterus having these capillaries, and then basically this little one cell can squeeze through it, and all this stuff is squeezing out into the interstitial space. And so if the platelets have stuck in those areas and called blood clotting, Lovenox, aspirin, prednisone all really help reduce that inflammation within the vessels, open them up better, allow oxygen to flow in, carbon dioxide to flow out, and it pumps up those follicular cells within the ovary and the endometrial cells within the uterine lining, which is going to help improve implantation and reduce miscarriage. So we use that a lot. I've been looking at Trental, pentoxifylline, Plaquenil, Humira, all these others I think are real important, because basically the cause of the inflammation is the body's reaction to the foreign plant antigens that get into our bodies at all these very small levels. And we've seen so many of our patients, diabetes gone, hypertension gone, irritable bowel colitis gone, and 50, 100 pounds gone in a few months. Now, I'm not here to say anyone needs to lose weight, because fat is the fuel for the fetus and your body always 24/7. The liver's function is to convert sugar and amino acids to fat to provide the energy for every single cell of our bodies. And I know this is pretty much a broken record that I share these same comments every single day. Thanks everyone for the shout out about the Wall Street Journal article. There might be a show coming out next week or two, morning show, to share a little bit more about what we have to offer between yoga, acupuncture, massage, and we really integrate these things. And so your job is to integrate them into your life today. It doesn't matter whether you're running around going to these stressful jobs or not. You have the power to listen to a really positive, uplifting story, to begin to think in a positive light of whatever's going on in your life, and this too. Imagine in some way this is a gift, a present, to help you learn and grow and share it with others. Remember, difficult things help us grow, all of us. And I've been through many of them, and I know that. Melissa Stacy, Miracle Princess, 8 months, awesome. And we really appreciate everyone sharing to everyone else the positive stories, the successes. That makes everyone see the possibilities. And if you haven't done a vision board, put those pictures on your mirror, on your walls, where you're going to see them all the time. You, your partner, the children you desire, all the belief systems that you want to bring in. And check out Rhonda Byrne's The Secret, and check out our book, The Fertile Secret, on Amazon or on our website. And we're really, remember, every month on a free IVF, whoever wins it, if they don't need it, you can give it away. And we have a new $4,500 monitoring and IVF package. And remember, if the first 3 fail and all the frozens, the 4th is as much as $600. So we're really working to help so many in need out there. And remember, from California, Oregon, and Washington to Florida, Georgia, the Carolinas, Rhode Island, Massachusetts, New Hampshire, and Maine, we're really here to share an idea. But the more you share ideas with this village, we think it's really important. Let's see, a vast reversal almost 2 years ago. Megan from Southern California, and I'm the kid from LA, Silver Lake, born and raised, and hung out in Newport Beach with my grandmother in a single wide trailer at Bayside Village. But I learned the work ethic at age 10, and really, the more we love what we're doing every day, it's got to be like a hobby. You want to imagine that work you're going to makes you feel good because you're helping others in whatever you're doing. Let's see. So 2 years ago, I had a reversal. Sperm quality has remained poor. So remember, what causes poor sperm? The same thing that causes poor eggs and infertility. It's inflammation in the gut. It's too much exercise. And remember, that exercise is heating up the core. That heat in the core, what does it do to the prostate, the testicles, your ovaries, and uterus? It damages them. The Ferrari on the racetrack is in the junkyard. The showroom Ferrari, that's what we are. You know, we occasionally take it out for a test drive. You want to slow it down. It's really critical. And your health and wellness really is determined by how well you can slow the brain down. Remember, meditation, prayer, yoga, massage, light therapy, oils. And Vicki Mullen has been really sharing and helping the essential oils, and we're really grateful. And our team, both in Buffalo, Rochester, Syracuse, and Albany, and our global team, which is you. This is the CMI Fertility team, which is helping all infertile individuals and couples out there and sharing a story that they might simply watch this and share it, take it to their RE, their OBGYN, and learn a few things that are a little crazy and different, and then suddenly, bam, a baby, when you least expect it. But remember, if you hold the dream and don't let it go, this is how these amazing things come through. Let's see. Carlo Ramos, stay super hopeful. And unfortunately, we have some that don't make it on this fertility journey, and they're seeking adoption, donor eggs, embryos, or sperm, or finding ways to help others in this journey to make themselves feel better, even when it's not happening to them. And that's really an amazing, amazing story. And we've seen so many. They've done 3, 5, 8, 10 years before success, even a gestational carrier. And we have many that are bringing their own egg donors, their own sperm donors. We can work with you. Your own gestational carriers, we're here to work with you. And I really apologize for the long waits to get to the conversation. We're doing our best. I need to be there for you. And Dr. Corley in Syracuse, Dr. Grossman, Dr. Ditkoff in Albany, Chris Dr. Carolyn D'Souza has joined us in Buffalo, is really helping. But we're working with all the docs in Buffalo, all the docs in Rochester, Syracuse, and Albany, and everywhere in this globe. We want to work with your docs to learn and help take care of you. That laparoscopy, hysteroscopy for endometriosis, I talk about it. It's critical. And we've been talking more and more about Orilissa, O-R-I-L-I-S-S-A. It's the GnRH antagonist. It's oral, 150 milligrams a day, which may be another one to try to suppress the endometriosis inflammation, along with LDN, CBD, human growth, DHEA, and remember, keto, 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 Kiltz is keto, Emmerich keto, and take a walk in nature and slow it down. Mariah Patterson, adenomyosis. All right. This may be where the Orilissa for 1 to 3 months or longer to suppress that endo. And remember, the adenomyosis is endometriosis in the wall of the uterus. It's a tremendous amount of inflammation. My bet, again, it's all from the gut. It's filling this bucket with gaseous, fermenting, alcohol-producing, methane gas-producing, bacteria and yeast loving carbohydrates. Remember, healthy fruit, fiber, vegetables, and lean meat is not so good for us the way we eat it. I also talk a lot about intermittent feasting. That means eat from time to time. I recommend one time at night before you rest and digest. Get off the treadmill. Breakfast, lunch, dinner, snacks in between is fueling the fermentation bucket, bad compost heap in you and I. Don't do it. Let's see here. Let's see. Cancer survivor suffering infertility due to treatment. Trace O'Hara, great. We highly recommend that the oncologists or doctors dealing with cancer really talk more about saving eggs and sperm and making embryos, and even some cases of doing ovarian tissue cryopreservation, and things like Lupron or the Orilissa is really, I think, can be very important for reducing the chances of losing your ovarian function. Let's see, Megan, and we take care of pre and post. We have ways of helping those with cancer who have no coverage at no charge, that are suffering from cancer and looking to cryopreserve eggs. And we have a really great egg and sperm system for those that want to bank it because they're not ready to have children today and they want to wait 3, 5, or 10 years or whatever it is. That's at CMI Fertility. We really like to work to help others, and Live Strong and some of the pharmaceutical companies that provide the medications can provide them and help you out in this process. Let's see, PCOS. Megan Hudnall, AMH is 11. My last doctor said I didn't have PCOS. Could this be an early sign? Well, you probably have polycystic ovarian syndrome and or metabolic syndrome, which is really prediabetes. It's a high carbohydrate diet, and the actual cause of PCOS is really likely an autoimmune disease. But I don't believe there's any such thing as an autoimmune disease. It's an inflammatory disorder caused by the antigens and the glycation that damages our bodies. It's a high glucose diet. Basically, glucose and insulin are high because we're packing the belly with carbs that are complex and are feeding the bloodstream sugar, glucose all day and all night. And the pancreas and the liver can't keep up with it. There's no such thing as insulin resistance, in my opinion, by the way. It's just that we're feeding the bloodstream with sugar all day and all night. Insulin can't keep up with it through the pancreas, and the liver can't convert it to fat fast enough. That's the deadly problem for all of us. And PCOS 11 is likely metabolic pre-diabetes, pre-PCOS, and that's where metformin or ovasitol, Kiltz or Emmerich keto, really critical. And low-dose naltrexone, and again, CBD, cannabinoid oil, I believe is another one, whether it's under the tongue, or it's an oral, or it's topical, or it's even through a vaporization. You may find some real great benefits. We've been using CB Distillery It's got to be less than 0.3% THC. We recommend no marijuana, no alcohol, no tobacco. Wine and spirits and beer are deadly for all of us. And this 1 glass or 2 glasses a day is no good. It feeds the inflammatory bucket of the bowels, which causes this leaky gut, colitis, Crohn's, you name it. Cancer is caused by a healthy diet, and I know I don't make sense. Read Thomas Seyfried's book, Cancer is a Metabolic Disorder, and look up Otto Warburg and the Warburg effect, and it's really, really an amazing, amazing story. Let's see, PCOS and didn't have many mature eggs at retrieval. How long do you suggest for a low and slow protocol? HJ Nero, how you doing tonight? So remember, metabolic syndrome, prediabetes, get down on the carbs. It's a high fat. It'll reduce the inflammation. Look again, LDN, CBD, ovasitol, metformin, and we're using a combination of either letrozole with 150 of Gonal-F, and you may trigger with the combination of Lupron and low-dose HCG. Now, low-dose 2,500 of HCG because you don't want to overstimulate the ovaries. And when you have PCOS, you just got to go longer, and sometimes you got to kick it a little higher early in the process. We're also doing with the priming protocol of 30 days of human growth hormone, LDN, keto, CBD, a week of either Lupron or antagonist, cetrotide, and then a little bit of progesterone. Period comes on, but the period is only necessary to thin out the lining if you're planning a fresh transfer. We do a lot of fresh and frozen transfers. One is better than the other depending on your personal needs and your personal profile. If the progesterone is over 1.5 the day of trigger, then we typically recommend a freeze-all either day 3 or at the blast stage, day 5, 6, or 7. If you're wanting to do PGS testing, pre-implantation genetic screening, then blastocyst is where you need to go. Interesting, not everyone makes blasts because the culture conditions may not be perfect, or the sperm may be abnormal even when we can't see it, and that abnormalities is actually a factor in getting a blast and a good embryo. Remember, some of the things that happen in infertility are not things that we can see. Remember, inflammation is very, very quiet, silent. Many cancers just show up at a terminal stage. Heart disease, the first sign is sudden death for some. This is the hard part to all of this. A lot of this is patience, persistent prayer. Now, I do this for learning, loving, and listening, and you can put them in it's the triad that we all need to practice because we're learning from each other. We're really, again, grateful to everyone for sharing their comments. Share this around for so many that want to learn about the story of affordability, quality, and access at CMI Fertility. Again, and we finance everyone, and we're always here to help. There are lots of ways to do this. Let's see. What can I do for Maria Gerlowitz to begin my menstrual cycle after being 4.5 months postpartum and 1 month after I stopped breastfeeding? Well, you don't necessarily need a menstrual cycle. It may be that you're not ovulating, you're not having the ovulatory surge and the progesterone rise, and that's why you're not having a period. But it would be good to get an ultrasound and a blood test, look at some of your hormones, thyroid, prolactin, estrogen, progesterone, and pregnancy test. And simply by some Provera, some progesterone, prometrium, we may be able to bring on a menstrual cycle if you have a thick lining. But if it's thin, we can often get you started for either a fresh or frozen, an IUI, or help you ovulate with either letrozole or Clomid. And we use those a lot as an oral method to increasing ovulation. And we do a lot of letrozole, Clomid, or natural trigger shots for either intercourse, IUI, IVF, or frozen transfers. When those high dose drugs aren't making more than 2 or 3 eggs, go low. Go low dose. All right? Danielle Torres, how you doing? Do you test hormone levels day of transfer and during 2-week wait? Current clinic does not. We do a lot of measuring the day of the transfer or the day before, week after. I'm not sure how much it matters that much, but it's one of those little things that if we think we could tweak the estrogen or progesterone levels, or your thyroid needs to be adjusted a little bit, we think it's helpful and important. And remember, we're doing the weekly intralipids to reduce inflammation, monthly IVIG, a lot more, because remember, it's the immune systems that's the challenge in all of this. So I know it all sounds a little crazy in all of this, and again, we're learning from everyone. Remember, share the likes, the loves, and we love you guys, by the way. And share it with others. Share it with those that are thinking about conceiving in a year, 2 or 3, because by doing Kiltz's keto and Emmerich keto, they're going to find that health and wellness. They're going to stop suffering from irritable bowel, colitis, foggy brain, or all that joint pain and discomfort. They're going to feel better, and that's what we want to see. Let's see. Shannon Hill, how you doing? Pregnancy and progesterone stays low, and I miscarry every time. Natural ways to raise progesterone. Well, keto, CBD, LDN, because it may be the inflammation in and around the ovary and in and around the hypothalamus and the pituitary gland that doesn't allow the natural LH and FSH surges that are really critical to improving the egg function, the sperm function, and the ovulatory process. If all those receptors in the ovary, in the follicle, are taken up by these antibody-antigen interactions, when the LH rises, it's not going to be able to kickstart and get that egg kicked out properly. If it's not kicked out properly, and you're not able to support the progesterone producing cells, again, it's going to be a low progesterone, but my bet is it's the inflammation that's damaging both the progesterone producing cells and the progesterone receptor cells. And so, again, this is why keto is king. And Brandy Lee, we're going to work on, we can get your consult into the Atlanta office, and we're going to be moving on getting some of those. Also, Dr. Ann Wold has just joined us tomorrow, and we're going to be able to get a lot of people in earlier and sharing these ideas and stories. And Shelly, Amy from Canada, and Dr. Fayez Farouki in Montreal and Toronto is really awesome. He's part of the CNY fertility team, but we're working on we're working with many of the clinics and docs in Montreal and Toronto to help those that are looking towards gender family balancing, or other methods that may not be offered there. Just some different ideas. Let's see. There's many medical bills from chemo, radiation, and bone marrow. It is kind of crazy how insurance is poorly covering cancer therapies and all sorts of medical conditions. We're here to help when it comes to infertility, if it's something that really, really needs it. We're turning no one away, one way or another. Shauna Fortitis, Jen Bornham, Hyper 2. Okay, so there's conversations going on all over here, and I'm sometimes just jumping in. And switched to PTU about 3 months ago since the best. So hyperthyroidism, PTU and a couple other meds may be necessary, but again, it's all immunologic, autoimmune cause. Is there any way to monitor with CY longer versus moving on to OB? Nicole Ford, good question. We are working with co-managing with your OBGYN throughout the first and second trimester. We're even doing intralipids and IVIG through the third trimester. And remember, keto is king throughout your pregnancy and throughout your life. Reduce the inflammation in and around your baby. miscarriages, preterm labor, preterm delivery, infections, you name it, it's all due to feeding the belly with all the bad stuff. That bucket is miserable. We know it all smells, it stinks because of the gas and inflammation caused by the high healthy diet we've all been managed and recommended by the healthcare, the food industry, and the pharmaceutical industry. It's not their intention to hurt us, by the way. Cognizant dissonance. Remember, we believe one thing, but actuality, something else is really happening here. And it doesn't make sense, I know it. Laparoscopy and peers have gotten significantly worse. Okay, so let's see, Jenny Young. So a laparoscopy for endo, and it may not be doing so well, or even if we didn't visually see the endo, it's hidden and under there. And this is where either Lupron, Depo, or Orlissa, and I think the Orlissa is going to trump the Lupron in so many ways. 150 milligrams once a day for 1 to 3 months or longer, even up to 2 years for pain. And I bet 1 to 3 months is going to help improve fertility, reduce inflammation. Estrogen is a cofactor for endometriosis and the inflammation. So high carb diet, plant antigens, phytochemicals, fiber, bacteria and yeast, glucose, and estrogen contribute to the development of endometriosis. So look to the Orlissa or possibly a repeat laparoscopy, hysteroscopy, or 30, 60, 90 days of antibiotics and looking at doxycycline, Zithromax, amoxicillin, Keflex, and even in some cases Levaquin, although we like to wait on that one. Let's see here. Transfer to mosaic embryo. If it's successful, my mantra would be longer at CMY, typically due to being mosaic. We're here to help you longer and not just kick you out. Any issues or questions always come back to the CMI fertility team. The early pregnancy and longer support, acupuncture, massage, light therapy, and I believe that LDN should be continued throughout pregnancy, and Kiltz's keto, Emmerich keto is critical. All right. And I'm looking towards Marie Emmerich and myself doing a talk with Wendy from Nature Time next year in the spring. We're really excited to bring so many here, do a live video talk. Really excited. Let's say, Michelle Fabio, do you recommend a 10-pound lifting weight limit for women on stims? Listen, I don't lift much, but less than that. And but if you use your back, go slow and easy. If it's hurting, don't do it. Try to slow down as much as you can. And 10, 15 pounds is probably a good limit. And 315-416-9872. Or Kiltz at cmyfertility.com. And those are my cell and email. And my personal and business Facebook is really for all of us to share health and wellness ideas. That's what this is all about. I do some videos and blogging, Mind, Body, Smile, Fertile Grounds Cafe. And a lot of that is just Kiltz's Keto Cafe. A lot of this is so critical. Remember, you are the most valuable, irreplaceable, expensive. Take care of yourself, your family, your partner, your children, like you know it is. Enough with the beer, the wine, the alcohol, the marijuana, any drugs. And once you get on these drugs for all these diseases, it gets harder and harder to get off them. And remember, I'm working to share this immune stuff, and there are some medications involved here. I'm a Western trained doc that still provides a lot of Western medicine. And so I get a lot of text messages, and if I don't get back to you, remember our global team, our web correspondence, and it's okay. You could bug me. I work to pass it on to Kimmy, to Becky, to Greta, to all the global team is awesome, amazing. Deanna, and really, really proud of everyone on the team. They're not perfect, like I'm not perfect. We're human beings. And one of the patients came in with a t-shirt, humankind, be both. And that's what we all need to work more at. And guys, and another one from a couple visiting was women are like ovens and men are like microwaves. Women need preheating. That means we all have to take our time with each other. Be patient in this whole journey, by the way, because there's a lot of pushing and shoving and anger and fear and regret and worry. We all bring it to the table. I've been there. If I've said or done anything to hurt anyone, please, I want you to forgive me. We're practicing medicine, and it's imperfect. And there are times when, again, no eggs, no embryos, no transfer, no pregnancy. IVF is not without some risk to this, all right? The medications, the procedures, they're very small, and the rewards are very big. Driving a car is very, very risky business. So just take that into approach and understand that we're all just humans on this crazy journey. All right, let's see here. Maria Guarles, 4.5 minutes supposed to, I think I answered that. Sorry, I may be hitting some of these again. Please accept. Nikki Long, how you doing? And when do you start intralupids when preparing for transfer? So Amanda Rasterez, I usually recommend intralupids about a week prior to transfer, but it can be done even the day of transfer. If you're doing keto for months, and remember, bacon, eggs, butter, beef, and Kiltz's ice cream, 1 pint of cream, 1 egg, 1 tablespoon of white sugar cane sugar, and 1 tablespoon of vanilla. But you can only have that once in a while, and it's a high fat. I do ribeye steak pretty much every day at night. No breakfast, no snacks, no seeds, no nuts, deadly, no vegetables. Now, I do occasionally have French fries fried in tallow or lard with dipped in mayonnaise. It's a simple sugar from time to time, intermittent feasting. This is the key. Let's see, Rebecca, okay, and Barbara, Thomas, low dose naltrexone. And let me see here. I want to give some shout outs here, by the way. So the LDN book, listen, there's so much out there, even CBD. Just start reading about cannabinoid oil and you'll see the amazing things that's being used for. And you don't need to wait for this, some pharmaceutical or some reputable expert to write the article that's going to say, hey, this is good for you. The marijuana plant and herbal medicine have been around for thousands and thousands and thousands of years. It's been used. We just need to step back and be open to the possibilities. If the risk is high, but the benefits are really, really high. Lindsay, how you doing? Lindsay Eastburn, and it's conceivable hypnosis can be very helpful. So check out Lindsay's website and connect with her, get a consult. And someone last week mentioned eat bacon, don't jog. And this is by Grant Peterson. And again, we're learning a lot of crazy new things that this guy used to do a ton of triathlons, the minis and weights and everything, has found how deadly they are for all of us. We want to get off the treadmill and slow it down. Critical. All right. Alicia Lee, how you doing? Believe someone with lupus and PCOS can still have success with IVF? Absolutely. Remember, lupus is an inflammatory autoimmune condition due to the binding of some particles to the phospholipids and damaging the cells and cell walls and the energy producing mitochondria. And they're all related to PCOS, which is just another inflammatory autoimmune disease. By looking towards, again, the full immune protocol. We've also been using the antihistamine protocol, Claritin, Benadryl, and Pepsid, pre-transfer and post-transfer for about a week, since we use a lot of the immune protocols. And we do work with Dr. Braverman, Dr. KK. The Alan Beer method is really amazing. Again, the leukocyte immunotransfusion up in Toronto at Markham Fertility, Mike Vero, and you can also go down to Mexico. But we've had clients from the Philippines, from Europe, from all over the world traveling and utilizing these methods, and we think they're really, really spectacular. Acupuncture, chiropractic, massage, light therapy, and herbs are really all available. We're going to be wrapping it up about 5 minutes. I could talk for hours and hours and hours. So always remember immune. It's inflammation, idiopathic, unexplained, unknown, is always inflammation. And the number one cause of inflammation is stress in the brain and stress in the mouth into the tummy. That's where it's all happening. Let's see. I think it's only 5% will increase in really the risk of multiples. I missed that. Let's see here. Cupping on the ovaries, uterus to increase blood flow to more successful cycle. This is Tara McCod. Acupuncture and cupping may help the blood flow, certainly either in the back or the lower abdomen. Donald Clark, really excellent. We have a great acupuncture team. Jennifer Waters, Chi, and Mike, and I'm not mentioning everyone, but there's a lot of people here in this journey. And Diane Credenza, I've learned from over the years in Colorado Springs, and a shout out to Paul Magarelli and the team out there. And there's acupuncturists around the globe that can help with many of these methods, by the way. Hey, Danette, how you doing? Carrie Freeman, does keto help lower testosterone levels? For women, it helps lower it, and for men, it helps bring it up. Because keto reduces inflammation in our ovaries and testicles and helps the blood flow. And also keto, the most important, it reduces sugar and insulin. Insulin stimulates testosterone production. It really is crazy. Michael Fabio, sorry. Any recommendation for men prior to retrieval? So keto, LDN, CBD, slow it down. I know. Dr. Kiltz, slow it down. I need to get into my pottery studio, my painting studio, and I need to keep writing a little bit more and sharing much more of this. So really great to hear from everyone. Next Sunday, I'm in Denver. I'm not likely going to get a chance at our Fertile Fireside Chat, but tune in and watch last week's or the last month's, share the stories. I am going to be sharing some stuff from Denver. So starting on the 6th, 7th, 8th, and 9th, and I'm going to take a few days off the 10th through the following Monday. I too can use a little rest and relaxation, but it's usually rejuvenating and reading. I'm always looking to read something new and different. If you haven't read The Art and Science of Low Carbohydrate Living by Finney and Volnick, I really recommend it. And the home run guy and book is Gary Taubes, Good Calories, Bad Calories. And if you audio it, it's really amazing. Check out our website. A lot of these are listed there, and we want you to be able to find them best ways possible. Maria, a good one. If you were told to wait for your menstrual cycle, I apologize. Hey, I don't get one. I need an ultrasound and blood work or Provera. Let's get going. So sometimes it's the habit, and we got to break those habits for some of the newbies that are helping us. Let me see if there's any other. Let's see. Again, we're about 58, almost 59 minutes in. Always my pleasure, by the way, and I thank you for sharing your ideas and thoughts and feelings. Remember, when you're hurting and you're sharing the anger, we want to know about it. We want to all learn from it. But at the end of the day, we all got to turn it around. Because remember, if you keep on in that angry spot, it's only going to hurt you. It's going to cause the ovaries to dysfunction and the sperm to dysfunction, even when they look normal. I know it's crazy, crazy, crazy. And grateful to the docs in Dallas, docs all over the country that have really been helping CMY Fertility offer our care to those that can't get it at the prices that we offer it at CMY Fertility. We really want to grow this experience. We're working on satellites in Manhattan or in the New Jersey area, but we're really working on those satellites through your OBGYNs, your fertility docs everywhere. We want to really change it up in this world. And Mind, Body, Smile, CMY Fertility, CMY Healing Arts, Fertile Hope Yoga, and Fertile Grounds. Again, I'm really, 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 really grateful to everyone for sharing your vibes with us. Remember, share this link with more and more. That way we can all find new ideas in the process. Let's see. Oh, endometrial receptivity assay. Yes. And we're going to be doing it down in Atlanta. And we'll work with your OBGYNs and your REs around the country also to help get that done. We think it can add a lot to the process. And one more here. My wife has PCOS, is currently on keto, continues to have horrible cysts preventing us from moving forward. The birth control pill Lupron or Orlissa or antagonist to suppress those may be helpful. And sometimes you just go for it even with the cysts. And in some cases, we recommend aspirating or excising the cysts. But quite frankly, don't wait for them to go away. Sometimes you just go forward with them. So if you're having any issues in the process, let me know. Again, Dr. Rob Kiltz, it's really a pleasure. Again, check out all the resources, share these around. God bless. Have an awesome day.